What I'm going to do is tell you a little bit about my story and my cancer experience, and then link it in with, I suppose, my survivorship programme and the things that I personally found helped me when I decided to take control of my life rather than having everybody else kind of controlling my life with me being a kind of passive recipient of healthcare. I did do quite a lot of that actually while people resuscitated me while I was being a passive recipient, so it's quite appropriate. And then I'm also going to talk a bit about my involvement with survivorship programmes both in Sheffield and in Barnsley, because I happen to live geographically almost exactly on the border between Sheffield and Barnsley. So I fortuitously, for funding purposes, fall into Barnsley healthcare, which is good because I'm a very expensive patient and they've never argued with that. But it's also good because it's enabled me to be involved with both quite legitimately. And I think I also want to very much finish on I suppose an up note that it is possible, as we've heard a lot today, to have life both with and beyond cancer that is extremely worthwhile, even when there's a lot of uncertainty about your long-term future. I've said. So I suppose my background is slightly odd in that in a sort of former life, I bizarrely was actually a paediatrician, a paediatric oncologist, and my special interest was in the long-term follow-up of children who were survivors of cancer. And I was involved in establishing the late effects service in Sheffield many years ago in the 1990s. Unfortunately, I then had to take ill health retirement. I had a very long-standing connective tissue disease, which I worked with for many years, kind of slightly sitting on a time bomb, romping up mountains in Borneo and Costa Rica and that sort of fact before the time bomb went off, which it eventually did. I took ill health retirement. I had a very severe exacerbation, which entailed 3 months as an inpatient in hospital. Let me tell you, never try and eat food in Hallamshire for 3 months as an inpatient. I actually sent out once a photograph of some fish that had been sent to me around all my friends, Diana was one of them, to ask people what they thought it was, because it was actually unrecognisable. But the only time I really saw a dietitian was when I was being tube fed, which is slightly bizarre, but anyway. I came out of hospital very significantly disabled, in a wheelchair, and also with very significantly reduced immune function, the significance of which will become clear later in the story, partly as a consequence of my actual disease and partly as a consequence of the treatment I'd needed in order to get me well enough to escape from Hallamshire, or prison as it's otherwise known in our family. And so me and everybody else was kind of just about getting our heads around this, and I went to a routine clinic appointment feeling quite optimistic about things, having had a scan done for a completely different purpose, to do with my connective tissue disease, and it was obviously not done like this because my consultant's extremely good, but it was sort of, well, the good news is that the vasculitis is under control, but the bad news is you've got breast cancer. And I literally had absolutely no expectation of anybody saying that to me whatsoever. It was a complete bolt from the blue. It was about 3 days before Christmas, and we had to go back and tell our 2 boys who'd just been through all of the previous 2 years that now I'd got breast cancer and was going to have to deal with that. We didn't know what it would involve at that point. Anyway, as luck would have it, I ended up with lymph node involvement, so I needed chemotherapy. They wouldn't do an axillary clearance because the anaesthetist basically said to my surgeon, I'd like you in and out as fast as possible. So he wasn't allowed to do anything. I wasn't allowed any fancy choices about operations, you know. Total mistake to me. That's the quickest thing to do, in and out, and fingers crossed. My chemotherapy, it's not really ideal to go into chemotherapy already ill and immune suppressed. It's not a very good combination. And I did try quite hard to die, but happily I didn't, despite a number of life-threatening infections. And so we got through all of that. Well, I say I got through all of that. But I was left with a number of problems. I mean, I haven't listed all my problems here. They now extend, the whole of my outpatient letters is my list of diagnoses, is the first sheet of A4. But if we talk about the impact of the cancer, And I'm interested that I haven't actually, I noticed, got pain on this slide. And I think that's because, for me, although pain has been a big problem and continues to be a problem, the thing which limits me infinitely more than pain is fatigue. And I think it's a very not undervalued, but under-recognised problem in terms of limiting people's lives. And I think if we were to look 10 years ahead, I guess maybe if someone could come up with a magic cure for fatigue, that would be the thing I would like most. If someone said to me, your pain can get 10 times worse, but I'll take away your fatigue, wouldn't even think about it. So left with lots of problems exacerbated by mine and some new problems. In particular, I had radiotherapy damage to my brachial plexus, which again we'll come back to later, and I needed an awful lot of steroids, and at that time I was significantly obese. But there's always what I like to call the ripple effect with all of this, isn't it? This isn't kind of happening in a little Helena vacuum. There's lots of other people who are affected by this. And this photo is taken on my eldest son's 18th birthday in my cubicle in Weston Park Hospital after one of my collapses. They wouldn't even let me out for an hour because I'd had a septicemic collapse the previous day. So he celebrated his 18th birthday in hospital because of my immune function. And if we're talking about late effects, I spent December of last year, the whole of December of last year, in Hallamshire again, with a pneumonia as a consequence of my poor immune function, and missed his graduation. So late effects is not just about physical late effects, it's about late effects in a much broader sense than that. So all of these things really are talking about loss of control, aren't they? Huge, huge loss of control. If you talk to people when they finish treatment, not even so much on treatment because you're on the hamster wheel, but when you finish treatment, you really do feel out of control. Everyone has taken control of your life. But eventually I decided that, and I'm well known as being quite a control freak, thank you, Diana, that I really had to take control of my life, and I was going to put together my own survivorship pathway that really, if anybody could, I really should be able to. So I accept that I'm speaking from a position of enormous privilege here, in that I am able to look at the medical literature and I do have access to resources and all those sorts of things. And this is just a list of the things which really made a difference to me. Now, the top two are what I would call holistic. Mindfulness meditation transformed my life, and that is not an understatement, and it is now recognised as being quite mainstream. I mean, it's NICE recommended for treatment for recurrent depression. There's quite a lot of literature. It's in the American Cancer Nurses long-term follow-up statement. Not quite sure I've got that wording right, but anyway, what I'm saying is that although we all think it's some kind of gonky, hippie, left-wing thing, that actually there is quite a lot of quite reasonable, respectable research which shows that it is of benefit in a whole range of healthcare conditions, and just life, actually. You don't have to be ill to get benefit from it. I was referred by them to a therapeutic yoga class, which is run at the Sheffield Yoga Centre, specifically for people with healthcare conditions. It's absolutely brilliant. The yoga class is designed specifically for your needs. They've got me completely upside down, hanging from ropes on the wall. I should have put a slide in, actually. Not at the moment, but I have done that. I went on a diet. I lost 30 kilos in weight, and if I can lose 30 kilos on weight in a wheelchair on steroids, anybody can. The therapeutic yoga person diagnosed my brachial plexus damage from my radiotherapy, which I had failed to diagnose, and referred me to a specialist breast cancer physio who also works at the Cavendish, but who I see privately. And she got me about an extra 60 degrees of movement in my arm, which is a lot, functionally, especially when you're functionally impaired anyway. I do as much exercise as I can. When I'm more well than I am at the moment, I try and walk on crutches rather than using a wheelchair. And for me, as my sons say, walking on crutches is like running a marathon. So, you know, it is exercise. And I think really importantly, I got some purpose back in my life. And an important component of that purpose was getting involved in survivorship stuff. It used some of my experience from when I was working, so it made me feel that wasn't a complete waste. And it made me feel that I was giving something back to a system which, despite the fact that I've kind of thrown a few criticisms at it, has been, on the whole, absolutely fantastic, unquestionably saved my life, and for which I'm eternally grateful. And I think we're so lucky in the UK to have the NHS. There's no question, if I lived somewhere with really expensive healthcare, well, I'd be dead, and certainly bankrupt. My treatment at the moment is about 50 grand a year to kind of keep me alive, and that, obviously, I wouldn't be able to pay myself. So I'm working both with the Sheffield Survivorship Strategy Group, the Physical Activity Programme. I really loved the design and the evaluation that Piers did the interviews for the bowel cancer evaluation, and I was involved in that, and the training was excellent, and it was a really good project to be involved in. I think the only problem was, as with all of these things, it was probably done slightly too early in the pathway, and that's an inevitable. The research always kind of is catching itself up. And I'm now kind of part of the Barnsley. This is the advantage of sitting on the fence, you see, between Sheffield and Barnsley, part of the Barnsley Survivorship Strategic Group, which is at an earlier stage, although there's some really good work going on in Barnsley. The actual Strategic Survivorship Group is at an earlier stage, but has got its first open space event planned. I think it's for the 23rd of June, is it? Yep. Really to hear the patient voice. I am a patient rep, I'm one person, and I'm not a representative patient of many patients. So I really want to be able to advocate for the advocates. And I kind of feel that in general, survivorship programmes should be more holistic. They should direct survivors to relevant information. I wasn't directed to relevant information, maybe because of all my other needs, and because I was medical, nobody really knew where to direct me. Don't forget about the ripple. I really like the peer-to-peer support models. You know, without my friends and family, I'd have gone under. And I really would endorse facilitating health promotion, not just physical exercise. I've never seen a dietitian, as I say, except when I was tube-fed. Despite being overweight, despite having a medical condition which requires me to be on a gluten-free diet, I've never seen a dietitian. But passionately, we should facilitate supported self-management. You know, who knows the patient best? I said in the panel discussion, there have been many times when I felt that if I didn't know what was going on, you know, things were really going to go pear-shaped. The majority of care is provided by myself and/or I am given 3 weekly infusions by my completely unmedically trained carer through a central line every 3 weeks. Imagine how much that would cost the NHS if I was in hospital every time, never mind my mental health. It gives you back control, and very importantly, there's lots of evidence that it actually improves patient outcomes. And I'm sure Kevin will agree with me, I think there's evidence now that the insurance companies are actually taking it on in America, and if they're taking on supported self-management, it must be of financial benefit, otherwise they wouldn't be doing it. I think what it's all about really is helping patients to live the very best life that they can live in the circumstances that they find themselves. And that can be anything from hospital at home, a fantastic Barnsley service on the left, to using a wheelbarrow when your wheelchair's broken down. So, thank you very much.